1 in 5 Americans will develop a skin cancer at some point during their life. The number one cancer diagnosis in the age group of 25 to 29 is a melanoma, a type of skin cancer. It's really important that patients get a skin check on an annual basis at least, so that we can catch those whenever they're early and so they don't become problematic. The American Academy of Dermatology recommends that people get skin checks, or at least an annual skin check, once a year starting at the age of 40. Now there are times when you would want to get a skin check before then. Like I said, 25 to 29 age group, number one cancer diagnosis is melanoma, so if you started at 40, that would be too late. And so patients that have lots of moles, a history of melanoma, really fair skin, or just have questions about places that develop on their body before the age of 40 should come in for a skin check as well. Now, when patients have a skin cancer, we see them more frequently. Some studies suggest there's up to a 50% chance of developing another skin cancer within 2 years of that initial diagnosis. So we'll see you more frequently. A lot of patients are hesitant to come in for skin checks. They don't want to take off their clothes and don't want to have areas looked at because they're just self-conscious or nervous about the whole situation. Whenever I have a patient that comes into the clinic and wants a full body skin exam, typically what we do is our nurse will room the patient, get their chief complaints about what areas in particular they're concerned about, and then we'll have them change into a gown. And patients can take off as little or as much clothing as they would like for areas to be examined. So whenever I go into the room, if they've changed into a gown, I usually start on the scalp and work my way down so I don't miss anything. And whenever I'm looking at areas that may be a little bit more embarrassing, or a patient's just not is a little bit more concerned about that area, I always use towels to keep them comfortable and to maintain modesty during the exam. Self-skin exams are really important to do outside of the dermatology clinic. And the reason for that is a lot of patients actually find either skin cancers or places of concern before they even come into the clinic. Whenever you're at home, I tell patients to take at least 1 day a month and spend about 5 or 10 minutes to look yourself over, have a friend or loved one take a look at your back or scalp, places that are difficult to look. And most all my patients, before they leave at the end of their visit, get an informational sheet about the ABCDEs of melanoma, how to check their bodies, and things to be concerned about. To get more skin education, go to our website at advancedskinmd.com.